Hi, my name is Sarah Jackson. This is my EDP 310 Understanding the Brain final project, and I chose the brain disorder of schizophrenia. So schizophrenia is a lifelong brain disorder, and it poses a high level of intrusiveness on a person's thoughts, feelings, and behaviors. This can include feelings of paranoia, hallucinations, delusions, distorted thoughts, and can include hearing voices. There are 4 different types. There's paranoid schizophrenia, and this is when it poses an extreme form of paranoia upon a person. They may behave oddly, have inappropriate emotional responses, and it can reduce their ability to show pleasure in life. There's catatonic schizophrenia, and a person experiencing this shuts down emotionally, mentally, and physically. They appear to be paralyzed. There's no drive to eat, drink, or urinate, and if it lasts for hours, it can become a medical emergency. There's undifferentiated schizophrenia, and this person may experience vague, various symptoms. So they may not talk or express themselves very much. They can be confused and paranoid. This person may not bother to change their clothes or take a shower. There's schizoaffective disorder, and this person has delusional thinking or other symptoms. They may also present one or more symptoms of a mood disorder, including depression, mania, and or hypomania. The cause of schizophrenia is ultimately unknown, but there are a few potential causes that can be tied back to schizophrenia. According to Andreasen in 1999, schizophrenia probably occurs as a consequence of multiple hits, which can include a combination of inherited genetic factors, and external non-genetic factors that affect the regulation and expression of genes governing the brain or that injure the brain directly. So the genetic predisposition. So some people may have a genetic predisposition that requires a convergence of additional factors to produce the expression of the disorder. This convergence results in abnormalities in brain development and maturation, a process that is ongoing during the first 2 decades of life. According to Mortensen et al., schizophrenia runs in families, and the reasoning presumed behind this is that there is a genetic predisposition in the family members that have it in common. However, Mortensen et al. Also discovers that studies indicate that familial genetic transmission can account for only a portion of the causes of schizophrenia. Since schizophrenia persists as an illness despite the fact that the majority of its victims do not marry or procreate, and since it appears to have the same lifetime prevalence throughout the world, it seems that multiple different non-specific, non-genetic factors that can affect neurodevelopment are implicated. So such non-genetic factors could come into play at any time during brain development and may primarily affect the regulation of the expression of many genes that influence brain development and function. So some examples of non-genetic factors can possibly contribute to the development of schizophrenia are infections during pregnancy or childhood, the effects of poor nutrition on fetal and childhood brain development, exposure to toxins that damage neurons or affect neurotransmitter systems, and exposure to radiation that might induce mutations. Signs and symptoms. According to Andreasen in 1999, the symptoms and signs of schizophrenia are diverse, and they encompass the entire range of human mental activity. So they can be present differently in each individual, and they may overlap and present in patterns. So these are some examples of symptoms. So abnormalities in perception, indifferential thinking, disorganized speech and language, social and motor behavior that appear to be disorganized and or stereotypy, initiation of goal-oriented activity, impoverishment of speech and mental activity, blunting of emotional expression, loss of ability to experience pleasure, and generalized deficit in cognitive systems, memory, attention, and executive function. So the onset typically is in late teens and early 20s when the brain is reaching maturation. And again, it can present in a wide range of symptoms and can onset at any time, or the symptoms can onset at any time and varies per individual. To diagnose schizophrenia, a doctor would essentially implement an assessment to see what the individual has been experiencing over a 1-month period and with some level of disturbance in their lives over the past 6 months. According to Carpenter, the current assessment used is based off of the Diagnostic and Statistical Manual of the American Psychiatric Association, widely used back in 1993. So the assessment screens for the following symptoms: delusions, hallucinations, disorganized speech, catatonic behavior, and reduced ability to function. So further, for diagnosis, there are also steps that a doctor can take to rule out other possibilities. So a doctor can conduct an MRI, and this can show other abnormalities in the brain that can present similar symptoms, such as a brain tumor or damaged parts of the brain. A routine blood test can help a doctor rule out conditions with similar symptoms, such as alcohol and drug abuse, and interactions between certain medications that can cause schizophrenia-like symptoms. Brain function. So schizophrenia also differs from the classic dementias in that there are no visible neuropathological markers such as plaques, tangles, or Lewy bodies. The gliosis, that is a marker of the neuronal death, is in the neurodegenerative diseases, is not present in schizophrenia. This suggests that the etiology and the pathophysiology of schizophrenia may be related to the maturational or developmental brain processes such as the formation of neurites, syptogenesis, neural pruning, or apoptosis. This defines the period for the changes that result in schizophrenia as sometime between the beginning of the neuron formation and migration around the second trimester and a young adult life. A common pathway that defines schizophrenia is the misregulation processing of the brain. So interventions and treatment. Schizophrenia requires a lifelong treatment even if an individual is free of symptoms. Prescribed medication is a staple to the treatment, and medication typically includes an antipsychotic medication and can include a combination of other medications as well. It typically takes a while to get the choice of medication and the dose correct for that individual, so treating schizophrenia with medication can be a super long, drawn-out process to find the right combination of medication. And antipsychotics have severe side effects, causing individuals prescribed to them to not often not take their medications because they can feel like their side effects impede on their daily living just as much. So other interventions in treatment include, coupled with medication, can include individual therapy. Psychotherapy may help to normalize thought patterns. Also, they can learn to cope with stress and identify early warning signs of relapse and can help people with schizophrenia manage their illness. Social skills training, so this focuses on improving communication and social interactions and improving the ability to participate in daily activities. Family therapy, this provides support and education to families dealing with schizophrenia. Vocational rehabilitation and supported employment. This focuses on helping people with schizophrenia prepare for, find, and keep jobs. Most individuals with schizophrenia require some form of daily living support, and unfortunately, hospitalization may be required during crisis periods or times of severe symptoms. So why I'm interested in this topic. I like to learn more about brain disorders, especially because they have an unknown exact cause, and something about that is really fascinating to me. I'm new to learning about the brain, as you could probably tell, but it's fascinating to me, and I plan to learn more about different brain disorders and how they occur and how they affect a person's daily living. I currently work in ABA therapy, and I work with learners on the autism spectrum, varying in the way it affects daily living and participating in daily activities. I would love someday to be a researcher of human behavior and brain disorders. So I love learning about the autism spectrum disorder, and I would hope to expand upon different brain disorders and learning how they affect human behavior and how we can come up with more effective treatment, because I do love ABA therapy and I do think it's beneficial, but I think there's so much more that needs to be researched and learned about it, because if implemented incorrectly, it can traumatize an individual more than it can help them. Some of the most important takeaways I've learned: symptoms of schizophrenia emerge in late teens and early 20s, which is something I didn't know. I guess when I pictured schizophrenia, I pictured it affecting like more people in their 30s and 40s and more middle-aged. I didn't realize that the emergence of schizophrenia can come as you're a teenager and you're experiencing all these other hormonal and like almost traumatizing events going on in your body. It runs in families because a family's genetic makeup can make them more vulnerable to the brain disorder. And then consistency with support throughout an individual with schizophrenia in their life is crucial to their success and independence. So I know from working in ABA therapy that when an individual is first diagnosed with a brain disorder, there's a lot of support that comes in. And then as soon as that person enters adulthood and starts to want to live an independent life, it's almost like support starts to slowly diminish. And so, along with autism spectrum disorder and other brain disorders, that consistency with support and treatment is vital because schizophrenia is a lifelong challenge for an individual diagnosed with it. What other people should know. Schizophrenia diagnosis does not mean that a person is dangerous. I definitely hopped into an internet rabbit hole learning about schizophrenia, and I watched a lot of TED Talks and a lot of videos, and I think something that people are wanting to bring forward and what they want heard is that schizophrenia doesn't mean a person is dangerous. It doesn't mean that a person is going to hurt you or hurt others, and often individuals with schizophrenia work really hard to be a functioning person in society, and they have to work way harder than somebody without schizophrenia to do that, and they work really hard so that they're not a danger to society or themselves. And I think it's important that people know that. Not everyone with schizophrenia diagnosis experiences the same symptoms. I also learned a lot about asking about symptoms and hallucinations is not really appropriate because I've heard from a few different speakers and TED Talks that asking about hallucinations is like connecting the real world with the way that their brain is processing the real world abnormally, and typically keeping them separate is a healthy way for them to manage what they're experiencing. And destigmatizing schizophrenia can help the course of action for many young adults afraid of coming forward and seeking help. When I learned about schizophrenia and it with the emergence happening for late teens and early 20s, that's a time when people struggle to seek help anyways. So destigmatizing mental illness and schizophrenia can really help a lot of people come forward and seek help sooner and get the help that they need. Here are my references. And thank you so much for listening. I hope I helped you learn something.